Okay, if we go back here and look at our hearts for a second again. Where's our heart? So when this oxygenated blood is coming off and going to the body, so the heart's a muscle that also needs its own blood. So on the outside of the heart muscle, you're going to find arteries there. So let's see if the picture, there's a picture here somewhere. Or not. There it is. So one of the first branches off the aorta is coming to give the actual heart tissue oxygen and nutrients. So we'll talk more about heart attacks and angina, but this is where those problems creep up. So when these arteries get blocked in some way, then pieces of the heart don't get enough oxygen and they can die. So that's what a heart attack essentially is. Okay. So that's cardiac circulation. So that's its own, cardiac means heart, and that's its own circulation. Yeah, these interesting pictures are here, but you'll get to see those up close in a bit. In the presentation, if these kind of diagrams help you, and some people they do, so it kind of shows the loops of how the blood flow, how it's all one big closed circuit. Yeah, so some people like that. So it's showing the right side of the heart getting blood there into the atrium, ventricle, and coming out to the lungs. So it actually shows it changing over to red in the lungs, then coming back to the left side, and then going out to the body, and then coming back. So those diagrams might help you when you're studying. There's also this guy, which is what? And there's another diagram too that when you're studying, maybe it will help you, but it's basically what I drew on the other board. It looks less confusing though. My terrible drawing. Okay. So when we're talking about coronary circulation, if you hear coronary circulation, that's the blood vessels that are on the outside of the heart. That's bringing oxygen and nutrients to the heart itself. What am I doing here? Okay. Oh, gosh. It's Monday, isn't it? Holy moly. Yeah, coronary circulation or cardiac circulation is the blood flow that goes directly to the heart muscle to supply the heart muscle. Okay, so we'll learn a little more about angina and myocardial infarction, which is just a fancy way of saying heart attack. But do you remember what myocardium was? Yeah, so that's the main muscle part of the heart, right? So that's kind of where that name comes from, myocardial infarction or infarction. So we kind of talked about this already. We went down to the lab and we did pulse and blood pressure and the fact that a cardiac cycle is both those lub-dubs. So it's both the contracting and the relaxing part of it. So we already talked about that. Cardiac output, so it's just an interesting fact that so most people have about 3 to 5 liters of blood in their body, and in 1 minute your heart will have pumped liters. So pretty much all of the blood in your body will have circulated one time through the loop in a minute. So that can be affected by how fast your heart's beating. So if you tend to be a person whose heart beats 100 beats a minute, so that could mean that that's changed some. And stroke volume is something they talk about. So with every contraction of the heart, your heart will push out a certain amount of blood. So if your heart is stronger, so if you're more fit, it might push out more. Or if you have heart damage, it might push out less. So if someone so we'll talk about like coronary artery disease and heart failure. So in heart failure, your heart's not as strong, it's not as efficient, so it's going to pump out less blood in one go. So blood vessels. So let's draw a picture, and then we'll come back here. So this what, the blood vessels? Well, we'll make it simple. We'll make it look more simple. So the largest, so we'll start with arteries. So arteries are the ones coming away from your heart. And so a fact about arteries, so let's just write a couple of facts here. So arteries carry blood away from the heart. And so there is a general rule. Generally, they carry the high oxygenated blood, except there's one case where it doesn't. So I'll write generally carries high oxygenated blood. Highly, let's say, oxygenated blood. So one exception. And if we look up here, so where pulmonary arteries are right here, and what kind of blood do they carry? Low oxygenated. So that's the one time where it's going to not be, so that's the one time where it will be confusing. So those pulmonary arteries that are going from the heart to the lungs, it's still away from the heart, so that works out okay, but it's low oxygenated. So we'll put one exception, pulmonary arteries have low oxygen. So largest artery in the body, does anybody know? Aorta. Largest artery in body, aorta. So in our picture, let's start with the aorta. So this big guy that's going to come off of the heart, so we have heart. So we have the aorta. Okay, so that's the largest artery. I don't know why that mattered, but there you go. So the largest one is the aorta. So as it branches off, there are all kinds of different arteries, and they have all kinds of different names. So when we were talking about different places to find the pulse, those arteries all have names. So carotid artery, there's a facial artery, there's a femoral artery behind your knee, there's a radial artery. All those places where we're checking pulse are arteries. So we're just going to call them arteries. So let's not worry about all of those different names. So the aorta is the biggest, which branches off into all the different arteries. So as they get smaller, so they'll get smaller and smaller and smaller. Let me make sure I'm spelling right. Arterioles. So as they get tiny, right before they turn into capillaries, which will be next, they're arterioles. Okay, so right before, and then they're capillaries. So what's a capillary? Not exactly. So capillaries are the tiniest blood vessels. So when I showed pictures last class of like a red blood cell barely squeezing through a blood vessel, those are probably capillaries. So they're the smallest in your body. Yeah, so smallest blood vessels in your body. What am I spelling here? Am I spelling vessels right, you guys? It looks weird. Smallest blood vessels in your body. Okay. So capillaries are where all of the transfer. So when I talk about blood carrying oxygen and carrying nutrients and hormones and all of that stuff, capillaries is where the transfer of that happens. So your body is covered really in capillaries, and that's where transfer of oxygen and nutrients happens. So that's how your cells get the oxygen and nutrients. So your capillaries are where it goes out of your blood into the cells that surround your capillaries. So transfer of oxygen and nutrients happens here, let's say. Here. So if we go back up here, so because that's where all of our transferring of oxygen and nutrients happening, so I'll change it to blue, which means low oxygen. So low oxygen happens here. So after the capillaries, that's when it changes to veins. So now we're traveling back to the heart. So arteries away from the heart, veins going back to the heart. So now that we've gone through these capillary beds, so think about just an example. So the aorta branches off, branches an artery going down to my fingertips. Let's say we're thinking about the capillaries in my fingertips. And in fact, you can kind of see the capillaries in your fingertips, because if you push on your nail bed, it will turn white for a second and then red will come back. Those are tiny, tiny, tiny blood vessels in there that you're seeing behind your nail bed or on your nail bed. So that's an example of capillaries. So the cells in my fingertip pick up oxygen, and then that blood is going to travel back up to my heart. So now we're veins. And the smallest little veins are called venules. Venules. Hopefully, yes. What, sorry? Arterioles? What did you say? Oh, I did. Oh, it's the smallest artery before you get to the capillaries. So the biggest is your aorta, and as it goes through the body, it turns into arteries, various kinds of arteries. And then right before you get to capillaries, your smallest arteries are called arterioles. Okay. So then we're into the capillaries. And then after you pick up all the oxygen and nutrients, your cells get them. And then we're into vein territory, because now it has to go back to the heart to get reboosted with oxygen. And the smallest veins are called venules. And then again, there's all kinds of different names for veins, but we're just going to call them veins. So venules are the tiniest veins that come off of the capillary. They sometimes call them capillary beds. And then, does anyone remember what the largest vein in the body is called? Right before it gets to the heart. So in our heart diagram, yay, the Vena Cava. That's the largest vein in the body. It's not generally about, yes. Yeah. Well, it's coming in the bottom, so let's say it's inferior. But in general, they just call them the Vena Cava. They just happen to call one of them superior because it goes on the top. All right. So let's add some veins here. So Vena Cava, largest vein in the body. Actually, let's add up here arterioles if you want, just to make it complicated. If you want to write arteriole, oh, I want it red. Since I put artery, aorta, largest artery, okay, let me make this. All right, so smallest of the arterioles, smallest arteries in body. Arterioles. So largest aorta, smallest arterioles, and in between all the arteries, all the different kinds. Capillaries. So veins carry blood back to the heart. To the heart, and generally they carry low oxygenated blood. One exception. But it's the same kind of spot. These pulmonary veins are your one exception. So these veins that are they are still carrying blood back to the heart, but they're coming from the lungs. So that's their one spot where you will have high oxygen levels in a vein. What? I don't know, maybe. Okay. How's it going, Mary? Good? Okay, so for those people that like lists instead, so let's do aorta. Artery. Arteriole. Capillaries. Venule. Veins. Vena Cava. Okay, so if you like a list to study, there's your list. Okay, there are some differences between arteries and veins. So that's one, that arteries generally have highly oxygenated blood. Arteries and veins. So which one do you think has higher blood pressure? Arteries. It's closer to the heart, so it makes sense that it's going to be higher blood pressure. So because it has higher blood pressure, think about, what do you think arteries or veins have thicker walls? So the walls of the blood vessel, some are thicker than others. Which one do you think is thicker? Arteries, and that's because there's higher blood pressure, so it's like a protective factor, right? So if you were to cut your artery, or would you bleed out faster than if you cut your vein? Yes. So if you've ever seen, I think I already said this, but if you've seen someone get a bad cut and it's spurting with every heartbeat, you've cut an artery. Most of the time when we cut ourselves, it's a vein and it will just kind of bleed and drip, right? It's not usually squirting. So veins, lower blood pressure. Thinner walls. More dangerous to injure an artery. So does anyone have or know of someone that has trouble with circulation in their legs, so like spider veins or dilated blood vessels in your leg? Yeah, so those are veins because they have less varicose veins, yeah. Yeah, yeah. So you can get them stripped out. You can. It is. Yes. So because veins have a lower blood pressure, sometimes if you're someone that works on their feet a lot, or sometimes it's genetic too, or if you're standing up on your feet a lot, it's harder for blood to get back to your heart up those veins. Um, so veins actually have something in them to make it a little easier. So they have valves. So same deal, why valves are there is to keep blood from backflowing. So veins contain valves. Yes. Yeah. Yep. So when you have like varicose veins or dilated veins or spider veins, it's usually a failure of these valves. So these valves aren't working properly, so they allow the blood to go back down where it shouldn't. And so over time they get worse, like you said, because it causes it to dilate more, because more blood will pool there. Oh, yeah. Okay. So again, the same thing here, like generally higher O2 generally carries higher O2 blood. And you can again add away from the heart. Arteries. Yeah. And then veins generally carry low O2. Because I'm flipping through. Arteries away. It will all be saved here, and I'll go back. So arteries away from the heart, carries high oxygen blood. Good there. Yeah. And then veins are generally carry low oxygenated blood and carries blood back to the heart. So those are some major differences between the two. In this room, I always feel like I'm in everybody's way. Artery away, yes. So this is a picture that shows some of what I was just talking about. So the artery having a thicker wall, which is kind of protective, right, because it has a high blood pressure in it. And the vein having a thinner wall. And in this picture, you can see the valves. So our muscles also help to move blood up because squeezing your muscles also squeezes the blood. So when they say get your blood flowing or get up and move, like that's literally actually helping your blood get back to your heart. So sitting for long periods of time that's why it's bad for you, because your blood doesn't have an easy time getting back up to where it's supposed to be. So when you're studying, if you want to study using the slides, you can. So we talked about these things. So arteries being under higher blood pressure, capillaries being the spot where the exchange happens out to your cells, and veins are collecting blood to return back to the heart. This is just a picture showing arteries in your body and all of those names for different arteries, but don't remember those. Someday when you're physicians doing cardiovascular surgery, you'll remember. And then this is a picture of all your veins. So the veins are bringing blood back up to your heart. Again, don't remember all of those either. Good. So I think we've talked about that lots. So it's just making a difference between, so systemic circulation is going out to the body, so your whole body. And then pulmonary circulation is just talking about when your blood goes out to your lungs, because pulmonary means lungs. So there's just these two kind of loops that happen in our body. So one loop goes out to the lungs, the other loop goes out to the body. So that's what it's talking about when it talks about systemic and pulmonary. There's another picture if it helps you study. So pulmonary loop is out to the lungs, systemic route out to the body. So blood pressure we did last time. Heart rate. Okay, so cardiovascular disorders. So I'm going to let you guys, I'm just going to check on Mary and Simone briefly. I'll let you guys work on your worksheets because you can probably fill in a few more things there. And then when I come back, we'll start on some of the disorders. Okay? Which one? Oh, the one I drew, yes, definitely. No. Yeah, no.